Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Wonderful. I'd like to get you dressed for the day. Is that okay? Very good. Let me close your curtain, wash my hands, get my supplies, and I'll be right back. After washing my hands, I'll gather my supplies. We'll start with a barrier, and then we'll ask the patient what they want to wear today. Mrs. Jones, what would you like to wear today? We'll get the outfit the patient described, including a pair of pants, a long sleeve button or snap front shirt, and a pair of socks, as well as a privacy blanket. Okay, Miss Jones, I've gathered our supplies here. So we're going to start with a privacy blanket. I'm going to lay this blanket out over you. This is going to help keep you warm and protect your privacy as we do this skill. I'm going to be careful not to snap or shake the blanket. We'll put it right over the sheet and pull the sheet down underneath. And we're going to pull that sheet all the way to the end of the bed. Okay, we're going to start with the socks. I'm going to take the first sock, scrunch it all the way up to the toe seam, and place it on the foot so the toe seam is lined up over the toes. And then I'm going to lift the leg from below and pull the sock over the heel gently. We want to smooth it out, making sure there's no wrinkles and the heel is in the heel place. We're going to do the same thing with the other side. Scrunch it up, put it on so that the toe seam is across the toes. We'll lift from below with a flat palm, put it over the heel, and smooth out all wrinkles. Okay, so now we're going to put your pants on. I'm going to unfold the pants and scrunch up the leg all the way to the end. And I'll put my hand in through backwards. I'm going to hold the foot to slide the pant leg over the foot, and then I'll lift from below to slide the pant leg over the heel. We'll repeat on the other side. So we're going to scrunch the pant leg up all the way to the end. Put our hand through and hold the foot in place with our hand while we slide the pant over the foot. Lift from below to put the pant leg over the heel. And then we're going to pull the pants up. Okay, Miss Jones, if I can have you lift your hips up for me. Very good. We'll pull the blanket down and straighten the legs. Because we have to undress the strong arm first, and your care plan indicated that your right arm was your weaker arm, I'm going to sit the head of the bed up to make this a little bit easier to get you dressed, and we'll undress your left arm first. So I'm just going to press the button to get you into a sitting or semi-reclining position. This makes it a little bit easier for dressing. And I'm going to help you sit forward by putting my hand on your upper back. And on the count of 3, you're going to sit forward. 1, 2, 3. Thank you very much. I'll hold you in place, untie that gown, and then we'll tuck that privacy blanket behind your back as we return you to a sitting position. We're going to remove the gown from this arm, supporting at the elbow as we lift, and then resting the elbow back on the bed. We'll move the gown to the other side. Okay, so we're going to remove the gown from your weaker arm now. So again, I'll tuck a corner of this blanket behind you. We're going to remove the gown from the weaker arm by lifting from below at the elbow to extend the elbow out very gently, minimizing motion. Then we'll rest it back on the bed. The gown will be put on the overbed table. Now we'll take the shirt, and our care plan specified a long sleeve, snap, or button front shirt. This is a snap front. So I'm going to take the sleeve and bunch it up, putting my hand in through backwards, and hold the patient's hand, holding all the fingers together, keeping the elbow on the bed as I slide the sleeve over my hand and the patient's. Then we'll lift from below at the elbow, supporting, and slide the arm sleeve all the way up. We'll rest that elbow back on the bed. Mrs. Jones, if I can assist you to sit forward, I'll put this shirt behind you around to the other side. Ready? 1, 2, 3. Thank you. We'll support at the upper back as we assist her. We want to smooth that shirt down. Come on back, Miss Jones. And I'll go to the other side to finish getting you dressed. And I'll help you put your arm in this sleeve. Again, we'll scrunch the sleeve all the way up, put our hand in through backwards, and this time, Miss Jones, if you can reach your arm back and grasp my hand. Thank you. Support at the elbow. And then we'll snap the shirt, making sure that the buttons are aligned properly and everything looks good. Now we'll remove the privacy blanket. Adjust your clothing for neatness and appearance. We'll wind the privacy blanket up in a ball, and I'm going to go get your gown, and we'll put these in dirty linen, and I'll be back to get you all settled. These items will go in dirty linen. I'm going to throw your barrier away. Ms. Jones, is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Would you like the head of the bed adjusted at all? Or your sheet back on? You're good like you are? Wonderful. Here's your call light. We're going to place it directly in the stronger hand. If you need anything, please press that red button and we'll be happy to assist you. Your bed is in the low position. The environment is clean. I'm going to open the curtain, go wash my hands, and if you need anything at all, please feel free to call. After washing my hands, I'll review the care plan to make sure that I undress the strong arm first and dress the weak arm first and put the call light in the stronger hand. I'll make any corrections that I need to make and then tell the evaluator my skill is done.